Good morning. I, Janvi Polumahanti, on behalf of TherapHeal, will be moderating today's session on socio-cultural landscape of the LGBTQIA plus community with facilitators Ankita Biswas ma'am, who is a senior clinical psychologist and the co-head of Internal Advisory Board. She has around 6+ years of experience for a wide array of areas like child and adult psychiatric disorders, emotional and behavioral problems, as well as critical life issues. Another facilitator with us is Archana ma'am, who is a consultant clinical psychologist with 7+ years of clinical experiences. She has published several research articles on behavioral addiction in national and international journals. So about therapy, so to say, at therapy we envision creating a safe, ethical, and trusted space across the globe for accessible, affordable, and inclusive mental health services for a more fulfilling life. Our team of 22 well-trained, licensed, ethical, and multicultural competent professionals trained from renowned institutes such as NIMHANS ensure this by offering inclusive and quality care. We aim to prioritize compassionate care, ethical practice, professional integrity, inclusivity, and social justice. In order to achieve this aim and align with our values, we provide numerous services ranging from psychotherapy, psychological assessment, corporate services, supervision workshops, webinars, and support groups. As a community and organization that strives for inclusivity, understanding, and support, it is essential that we address the challenges faced by the LGBTQIA plus community. Therefore, today we gather to delve into the socio-cultural landscape of the LGBTQIA plus community. By exploring the cultural, societal, historical context in which these individuals navigate their identities, we can gain deeper understanding of the challenges they face and the progress that has been made. Let us embrace the power of education, empathy, and compassion as we discuss sociocultural factors and how it shapes power dynamics. Joining us is Mr. Mohan Raju. He is a MPhil in clinical psychology from the National Institute of Mental Health and Neurosciences and has 14 years of experience in offering clinical psychological services in various clinical settings. His areas of interest include adult intimate relationships, gender, sex, and sexuality. He's also a UN certified stress counselor and has co developed 3 session brief intervention module for suicide prevention. He has research study in topics like emotionally focused couple therapy with gay men and self concept among preoperative transsexual women from India, among many other such researchers. As we begin, I encourage all the viewers to actively participate through the comment section and feel free to ask questions. Let us engage in a respectful and open dialogue that fosters learning and empowers us to make a difference. Over to you, Ankita.
Thank you, Janvi, and I welcome everyone on behalf of TherapHeal in this forum. So, as we observe this Pride Month in June to respect the rights of the queer individuals, we would also like to mention that Pride is not just about a month for special attention, but a feeling of acceptance and acknowledging the diversity in human gender. So, hence, we at Therapy, we aim to observe and celebrate our queer selves beyond this month and would like to take on our journey ahead over the year as well and years to come. Today, we are extremely delighted to have Mr. Mohan Raju with us. Thank you for your time. And we are extremely excited to know from you about different intersections, the impacts, and how pure individuals are impacted by that. So, to begin with, we would like to know that if we see that in 2023, India seems to have come a pretty long way in terms of understanding the needs of queer humans and also acknowledging their gender, their identity as well. And however, I guess there's much to go. And if we can understand that where things have evolved from, it will be better for understanding their journey as well. So, my question to you, Mr. Mohan, is that how do you feel does the historical and cultural context of India influence the experiences of the LGBTQIA community?
Right. Um, Thank you for that, Ankita. It's quite a broad question. To understand, LGBT identities have been there throughout human history. Even in countries like India, we have documented history of people with different gender identities, different sexual orientations living here. That is the history bit of it. But people from time to time, even in those good old days, people which we try to look at through a certain lens, did experience discrimination, did experience marginalization even in the olden days. Uh, we uh, we have examples from India where we talk about Khajuraho temples where there is depiction of same-sex attraction being there, or our mythologies, our histories full of queer lives, but were they accepted as part of the society, mainstream society? I doubt that. It's very possible that they were tolerated identities. They were definitely not criminalized to the extent that we see post, colonization. Um, Yes, there were difficulties that LGBT individuals have faced for a long, long time. But the fight for rights, the fights for equality, freedom, these are all much, much newer that way. Fight for rights of LGBT individuals. Hardly we have maybe 100-year history of rights. This too, they got intensified only after the second wave of feminism, that is in the 70s. Same thing with India, perhaps with the HIV/AIDS pandemic. LGBT rights started getting some voice here in India also. Perhaps in the 80s and 90s, the first petition filed in the court against same-sex activity was in 1994. That was the first time somebody thought, like, this is a law that is criminalizing a big chunk of population, and that is when it all started. After that, it's hardly been like maybe 30 years now that we've been fighting for our rights. We've gone through a lot of things in this. The whole NAS Foundation uh, fight itself took almost 30 years. Only in 2018 did we have the Supreme Court reading down same-sex acts as being illegal. That was after so many years of fight. uh, Transgender rights were again, we've seen significant challenges there as well, though we had a very progressive judgment in 2014 which where transgender identities were respected and protected. Then we had another law that came into force in 2019, which again made it quite difficult for transgender people to identify themselves with a chosen gender, where legal requirement was that you had to undergo medical or surgical transitioning to choose the gender, which was against the spirit of self-determination that NALSA Act proposed. So, in the Indian context as well, the history is brief up comparatively, and we've seen quite a lot of changes that have happened in the last few years with respect to societal and the legal changes that have come about.
Right. So I guess that has been a wonderful journey towards how it started from the era of Mahabharata and our the architecture and through the legal advancement that we have reached. However, as you just spoke about the marginalization, I think definitely the transgender community, the homosexual community, do face compounded discrimination and limited access to support and resources due to the intersectional factors. And also, if they are belonging to any marginalized community, it becomes more and more distressing. So, what is the current scenario, Dr. Mohan, in several strata in different geographical locations, being it urban or a bit suburban, and how does this intersectionalities impact the individuals? If you can share some insight.
Right. We already know that non-normative genders and sexual orientations have faced significant discrimination, but this discrimination, like you say, get compounded by other intersectional factors also, right? For example, the experiences of a cisgender gay man is not the same as the experiences of a Dalit trans woman. This again, if somebody has a disability, the experiences are very different. A few years ago, there was one perhaps touted as India's first matrimonial ad of a famous LGBT activist from Bombay. It said the mother posted the ad saying that a gay man is required, a gay groom is required, caste no bar, higher preferred. So what does this tell us about how intersectional roles, how intersectional factors play in our society? So for example, another example that one can think of is there have been several cries for inclusion of affirmation, affirmative actions for transgender people especially. People have proposed that they should be included in the other backward caste list, OBC category. In fact, Tamil Nadu, if I'm not wrong, already has an affirmative program called the MBC. They're considered in most backward caste list. But this again does not solve the problem. What happens to Dalit transgender person? So they can either get reservation as a Dalit person, which again is significantly marginalized, or they can go for a lesser degree of reservation, affirmative action, as the MBC category. But this transgender Dalit person in Tamil Nadu is going through two-sided discrimination. They are being discriminated for being transgender and on one end, and they're being discriminated for being Dalit also. So intersectionality is all about recognizing that discriminations can happen, are always multi-pronged. It is not just one position that we can take. So the same happens with disabilities also. If somebody has a disability, they are experiencing another level of discrimination, another level of disability. So identifying this, and perhaps in the current scenario, we only, because in India, if you can claim a reservation, you can claim only one reservation, though you belong to multiple positions of marginalization. If you are a woman, there are quotas and some jobs for women, or for Dalits, or or your physical ability or disability, you can claim, but you can claim only one. What if I'm experiencing all those disabilities? But current Indian legal framework does not allow for multiple affirmative benefits. They may have their own reasons for that, but it's important to recognize that we don't exist in vacuum. We don't exist without my other identities. Some of my identities may be more powerful. Some of my identities may not be that. I may be marginalized. I may be stigmatized in one of my identities. Being a cis man, I may experience a certain privilege. Being a male, I may experience a certain privilege. I may experience a certain disadvantage because of my caste status, because of my sexual orientation, because of my gender identity, because of my physical ability, because of my marital status too. So all these are compounding, and they all continue to influence me. I don't live my life in separate boxes. When I enter a room, I am a cis man, I am a Dalit person, I am a bisexual man, I am an English speaking person, I am an urban person. All these identities are always there with me, and some of them may carry some advantages for me, some of them may not. But they all put together make me as a person. And without recognizing this, and pigeonholing one person into one identity, takes away all our efforts at affirmation, or all our efforts at bringing people from different backgrounds into the mainstream.
Yeah, absolutely. And I feel the concept of understanding self from a different point of view has been much unacknowledged and denied till date. We tend to keep them, as you said, in pigeon boxes, because that's easier for us to categorize and understand, less of brain work. But definitely it's I guess a lot of need for awareness is required to actually give everyone, be it a cis or a trans person, inclusive of all their identities, and get what they need to or deserve to. Thank you.
Right.
Yeah.
As you also giving us an overview of how this intersections playing a role psychologically with the discrimination and other things, can you tell us briefly about what is the effect of these intersectional discriminations affect the queer community psychologically? If you could give an
Right.
overview of it. Yeah.
Right. Like I mentioned, we all experience marginalization because of our identities. It gets only compounded. We know that there are inequities in our society. These inequities definitely impact my physical as well as my mental health. The way I go about receiving health itself. For example, for me, if I'm a trans person, me going to a doctor and seeking health advice itself may become a difficulty given my transgender status. I'm already fearing one discrimination that the doctor is going to treat me differently because of my gender identity and expression. Then also the judgment that I may have to face because of whatever infection or illness that I am carrying there. So my being transgender becomes a difficulty. My social class becomes a difficulty, and I may stop seeking, health benefits at all sometimes. So there was a study conducted a couple of years ago with some researchers from TIS and other places where they looked at how discrimination is there in the healthcare system itself. People belonging to different marginalized sections, how they don't even reach out to doctors for medical information or seek health advice because there is significant discrimination there again. So, if you look at the intersectionality of this, again, this is not again, not just the transgender status. It also depends on whether I'm an English-speaking transgender person, whether I belong to, a well-off middle-class family, whether I live in the city, whether I live in the rural area. All this play a role. As you can see, I experience intersectional stigma here. I'm not experiencing just one stigma. I may be experiencing stigma because of my language facility, my place of residence, uh, and many other intersectional identities that can be there. One can imagine the amount of stress the individual experiences when all this get compounded. This stress cannot be accounted for by only one identity, right? And this is a unique kind of stress, very unique to people belonging to LGBTQI population.
Yeah, right, right. We also see here that intersection is also like the place of living. There is also an urban and there's also rural. If we
Yes.
have to see the urban seems to have more support groups, networking, varies of resources. But in the rural, we see like resources is much less compared to the urban. There's a lot of differences and coming across in the urban background versus the rural background. So when we have such kind of a differences, how can we shape the acceptance in the community and how we can overcome the disparity here?
So this again, I think takes we need to approach this from many different angles. One is about today the scenario is slightly changing. We are having nowadays we hear of cities like Surat or Mysore or other tier two cities. I don't know if Surat is a tier two city, but there are tier two cities that continue to have LGBT pride parades in India today. This is one way of making people aware, becoming more and more visible. There are smaller towns across India where there are NGOs that work especially with transgender people, if not the whole spectrum. So there is because again in the Indian context, the visibility of transgender people, especially in the cultural context, has been there for a long, long time. People do recognize transgender people, though the language may be different. The language may be, Joktas, Jogtis, or Kinnars, Hijdas, or many, many different identities that are there, but they are visible in the society. So, and there is some work happening for a long time, especially post the HIV pandemic. This kind of NGO and CBO work has become more or less universal in India. Even in small towns, you have groups that work for the benefits of transgender people. That is, in a way, that can be used as a network to educate the general populace about different gender identities and sexual orientation. And this the second thing that I mentioned is about how pride parades, pride marches can sensitize people about different gender identities and sexual orientation. I know of my own friends who go to smaller towns whenever there is a pride in a different city or in a smaller city, just so that the numbers swell and people do recognize that we exist. The visibility factor becomes very, very important. And of course, uh, being an ally, if I want to do more about it, as health practitioners, we can provide services to people in the rural or semi-urban, suburban areas. And of course, how media can be utilized. We have seen in the last few years significant media coverage for LGBT events because these are colorful. If you go to any gay pride or LGBT pride, they're almost like a carnival. So media wants to capture that. Media wants to show what people want to see. Bright colors, bright clothes, all of that. So, and again, the whole 377 judgment or the idea of same-sex marriages, they've all caught media attention because people want to hear about it. And for good or bad, there is discussion in the media today about gender identities and sexual orientation. This can be steered in the right direction by engaging with the media as mental health professionals or even as health professionals. We can sensitize at the community level itself, right,
Okay.
about giving the right information to the general public about gender identity or sexual orientation, normalizing them. All this can happen. And today media is present across the countries. Social media especially reaches villages too. So this way we can bring more and more awareness and sensitivity about gender identities and sexual orientation.
All right. Thank you so much, Dr. Mohan, for enlightening, giving us this overview how we can overcome the differences and other things.
So exactly, the social media has played a huge role, I guess, in, as you said, sensitizing many people. However, there it has been seen that there is a core level of understanding in several age groups that definitely hinder the process of awareness. So, if we see that the queer identities may be much more acceptable to the Indian youths, but not
Mhm.
to more of an elderly population. And as I just want to mention an experience about the media, although social media is all everywhere showing the pride parades, celebrating June as a month of pride, there is also some media who is trying to. And just few days back, I saw a news where one journalist was trying to, moral police a lady who expressed her wish to become a trans man, and she actually belonged to a huge social strata, being a minister's daughter. And how can a minister's daughter be a man? This became a huge sensation.
Right,
So
right,
therefore, I mean, and that was supported by the elderly population, that, oh, this is, absolutely a no-no, while the youth absolutely went against it. So there are several areas of social media, I guess, which is coming up and giving us a lot of information about what to understand and how to understand. However, in terms of acceptance, definitely socially there has been a change, but we still see that there's a constant struggle that the queer individuals face in terms of opportunities. They miss out a lot on opportunities. Even in various places, they do face discrimination. So, Dr. Mohan, what sort of challenges do you feel that exist in their representation in different sections of our socio-political organizations or cultural settings or professional forums or even educational settings?
Right, right. Thank you for that. I think it's an important thing to talk about. Again, my experience is from a city like Bangalore, where I lived most of my life. One thing I just wanted to clarify, though June is celebrated as the month of Pride across most parts of the world, in Bangalore we celebrate Pride in the month of November. Bangalore Pride happens in the last in the last week of November. In fact, the last Sunday of November is when Bangalore Pride happens, just because of weather reasons. Though I think because of social media influence, now we are celebrating Pride Month in Bangalore, even in the month of June. It's like double bonanza.
Yeah.
Uh, yeah, about the representation itself. The representation has to happen at all different levels, right? We do have some representation now in the health, in the field of health, in the field of law. We have, I think, two or three transgender judges in West Bengal and Assam. We have police officers who identify as trans, and we have politicians who openly or not openly, in private, they may identify as belonging to the LGBT sections. Like this, representation has to happen at different levels. Like you need school teachers who come out as LGBT principals. We do have, again, I think West Bengal that way is quite open. Where I know that you're referring to the ex chief minister's ex chief minister's child who identifies as a trans man, and he's been quite vocal about it. But when people from this powerful sections of the society do come out, it gives an incentive to popularize or to normalize, sorry for my language, to normalize different gender identities. I think I use that as a positive opportunity to talk about transgender identities, than look at it as like, oh, there is a backlash toward this person. So that gives an impetus. Like the current, again, prominent politician from Karnataka, his child is a trans woman. So there are these examples, and these examples are very powerful that way in helping people bring gender identity into the conversation, into the living room itself. So it takes time. We live in a very normative society. Caste is still such a big thing to talk about. Bringing your Dalit friend into the home is such a big thing to talk about. Bringing your unmarried girlfriend into your home to introduce your parents is a difficult thing to do in our society. So a person with different sexual orientation, person with different gender identity, again, they will take some time. If there is a difference between different age groups in acceptance, perhaps, but that applies to anything. For example, if you introduce sushi into your home, very likely the younger population is more likely to take a liking to it than the older population. It's about the rigidity and the flexibility that comes with age. So, but you definitely are seeing changes. Things are not as bleak as they sound. Also, if we have parents who form groups, parents who are coming out and talking openly about their queer children, supporting their children. So that is also happening in the same, at the same time. But of course, we do need better representation. We need more and more representation, because it's a long way to go. uh, our mainstream media, again, does not project or does not portray gender identities and sexual orientations in an affirming or in a positive way. If you can remember, whether it be it Hollywood or Bollywood or uh, Tamil, Malayalam, Kannada cinema, there are some examples here and there where positive models have been shown of people belong. Most often it is pejorative. It is made as a caricature. So this kind of representation harms the community. You are you're the butt of jokes, all jokes around it. So that kind of representation again is very, very harmful to our society, and that is a change we can seek, because media will give us what consumers want. So if media, we start rejecting that, we start voicing our opinions, even either as members of the community or as allies of the community. If we start voicing our dissent, very likely that media will change. Media, because media wants our attention, right? So the representation will change once we start dissenting this kind of portrayals of different gender identities and sexual orientation on our screen. I know that especially with portals like Netflix or Prime, there is much more sensitive portrayal. Possibly, there's the American liberal mindset that comes with it, or they cater to the urban English-speaking audience. There is more sensitive portrayal of queer characters in some sections of the media, but largely the mainstream media, especially cinema and television, continue to caricaturize uh, queer identities, and that needs to change.
Yeah, so definitely media can be a medium to transform the beliefs.
Right.
Absolutely. However, I was also thinking, I would like your opinion on that, as because the rights have been legalized, the 2019 Act, and there has been a ban in discrimination, bullying. Still, it exists in every level, be it in school, a teenager facing the issues, be it in office, be it in college. So, if do you feel there are also programs happening in schools and in educational settings and workplaces which make others aware of the their insensitivity, the needs of the queer individuals, and the need for acceptance them as humans first beyond their gender? So these, do you feel, are also happening apart from the media influence?
So the 2019 judgment that you're referring to is the Transgender Act. So this applies only to transgender people and not to the whole spectrum of LGBT, right? LGBT is again a broader spectrum. If a gay child experiences bullying in school, there is no protection. Again, not that a trans child is protected in that way, though it is there in the law now. Um, so we do not have anti-discrimination as a law against LGBT individuals in India. There are some progresses have been made, like consensual sexual activities are made legal, or I shouldn't say legal, they've been decriminalized. They were previously criminalized and now they are decriminalized. And in the Transgender Act, it's possible for you to now legally change gender, provided you get, the district magistrate or the expert certificate, which are again problematic. Only these have happened. So anti-discrimination laws still don't exist as such. People are interpreting law differently, like using sex as sexual orientation to bring about some changes, but it's not there in the law as such. So we cannot claim that. And for law to become part of society, it takes a longer time. I don't know how many people in the law enforcement system are aware of the nuances of the law itself. So we cannot, that is one fight that has been happening about introducing anti-discrimination. And this can apply to government jobs, but what happens to private sector? This is not applicable there. Even if you look at the Transgender Act, it applies to government sector. Of course, it does mention domestic violence and all that, but again, that's again problematic. You cannot be violent toward the child if the child is trans, but the child is thrown back into the same family that is violent, according to the current law, the current act of 2019. So there are, this is again discriminatory, right? So what is there in the law is, they all sound quite pleasant to the ears, but the reality is not the same. right? And about I forgot to mention about, nowadays a lot of multinational organization, multinational corporations are trying to include, the buzzword is, diversity and inclusion, right? So they are trying to hire people who are transgenders, but again at a very tokenistic level, right? So are they there in positions of power is what we need to understand. That tells us whether there is inclusion in their policy, right? So you can hire one transgender person as an attender or a peon in the organization, and you can claim that you're diverse. But are you really inclusive is a question, and that can happen if we have stronger impetus for impetus of for anti-discrimination law in the educational setting, where transgender people do not drop out. A lot of transgender individuals drop out of schools or colleges because of the bullying they face. It can, to a small, to an extent, even other sexual minorities also experience this bullying, and they may or may not be able to complete their professional qualifications because of this, right? So that all that can stop once anti-discrimination laws are in place and are followed strictly.
Right.
So, as we are also discussing more on a community perspective, on a cultural perspective, can you tell us, like, what is the role of family in building up the acceptance among LGBTIQI community? And we also see a lot of minor queers are also coming across. So, like, how is the family or the parents helping them to give us acceptance and support?
So most of us grow up in families, and our personalities get formed in families, right? The first adults we meet are our parents, then perhaps our teachers, or so w- all sorts of life lessons we learn from people in the family. So family does play a major role. How supportive they are, not supportive they are, all of that definitely matters. Children who get supported by their parents, by the elders in the family, definitely tend to have greater self-esteem about themselves, are greater or more immune to bullying experiences. Children who are discriminated in the family itself face double discrimination. They are not only being discriminated on the street, in the school, but also at home. Like parents not allowing children to express their gender identity the way they want. Uh, you know, y- Parents calling the children sissy or any of those derogatory terms. All that can play into the psyche of this growing mind. The child can develop significant sense of poor poor self-esteem, which can result in um, poorer mental health outcomes as an adult or even as a child. So minors experience significant bullying from family members. I've had experiences, where patients have told that they would get beaten up for talking a certain way, acting a certain way, or wanting to dress in a certain way, having to do everything in stealth. This is the kind of stress that I'm talking about, which is very unique to LGBT people, which is more than what another child might experience. Other child may also experience discrimination, may also experience stress, but when you belong to a gender or a sexual minority, that becomes further problematic. Your relationships not being accepted. That is, of course, once the person becomes an adult, but even as a minor, expression of gender itself, or the games that the child wants to play, that not being accepted, being forced into uh, dressing a certain way, playing a certain games, walking a certain way, all this can have significant psychological impact on the child. So, if parents can be a little more supportive, parents can understand that gender identity is not a preference, gender identity is not a choice that the child makes. It is something that is inherent, that happens perhaps in the womb itself, right? So, allowing the child to grow and providing a supportive atmosphere for the child to uh, develop their own sense of identity, and remembering that if your child is showing certain non-normative gender expression does not necessarily mean that the child is going to be trans tomorrow. The child may turn out to be cis also, and that is perfectly okay. Children explore these identities from time to time. Being more and more supportive is important. It's your child, and most parents declare that they love their children. So show your love by being supportive, by accepting whatever gender identities, whatever gender expression your child shows.
Right. So I understand like it's also be challenging for some of the parents to immediately come with an acceptance and other things. And so in this context, like how as a community we can build a healthy allyship starting from the workplace, at the family context, as a friend, we are also being a mental health professional. How can we also encourage a health allyship in the society? What are your views? And if you could tell us from
Right,
your experiences how
right.
you're building up an allyship. Yeah.
Being parent of a queer child is definitely not easy because the parent is perhaps scared of what might happen to my child when they grow up. So that fear is definitely validated. That fear is definitely valid, right? But what can I do? Being an ally, to your either your child or to a friend or to a colleague, can happen at multiple levels, right? So it can happen at individual level, at an interpersonal level, or at a structural level. At an individual level, you can learn more about transgender, LGBT identities. I keep saying trans. Please correct me whenever I say that. I'm talking about diverse gender identity and sexual orientation. I can learn more and more about the experiences of other queer people, right? That is one thing. I can learn about their experience of prejudice, their experience of discrimination, and how that has impacted the history of queer identities and the movement. Me reading on my own today. The world is at our fingertips. We can just type and everything is available to us. First thing that we can do as an ally is to learn more about gender and sexual identities. That is at the individual level I can do, right? And me clarifying doubts for my own self about what is what, and at an interpersonal level, me standing up for the other person. It can happen either for my own child, me standing up for my child's rights in the family. For example, if one parent is if the grandparents are not okay, if one of the parents is an ally, can become an ally, they can stand up for the child's rights, right? Or as a colleague, I can be an ally to somebody. If I hear trans-specific bullying or bullying of a gay colleague of mine, me voicing my dissent, being an ally is being active. I'm not going to sit there and listen to any kind of discrimination that is being meted out to a person from gender or sexual minority. I speak up against such discrimination. That is being an ally. At an interpersonal level, I can voice my opinions every time there is some kind of discrimination. Smaller things like, when are you getting married to a lesbian woman in an office? That's a form of discrimination. That's a form of psychological harassment that can be meted out to a same-sex person, right? And if I'm an ally, I can stop such question, or I can uh, uh, you know being an ally is also about calling out the bullshit, right? So I can talk about this, and I can be an ally at a structural level. Like I said, about engaging with the media, engaging with government. So I can, or engaging with corporations. If I'm working in a corporate setup, how do I make our environment, our work environment, more inclusive? That is about being an ally. Have you considered hiring more gender diverse people in our organization? So that is also about being an ally, right? So allyship can take multiple forms.
Alright. Thank you. Thank you so much for that valuable insight about an allyship.
So throughout
So
the discussion, we have been talking about the transgender community as well, and as you mentioned about allyship. However, though this community has been one of the oldest communities in the Indian setting, we still tend to perceive them solely through the lens of their gender identity, overlooking, say, the diverse contributions they have towards our society, particularly as we stereotype them to be sex workers or beggars when it comes to the transgender community, right? So, how do we, as an ally or as a society, how are we contributing to the existence of these stereotypes that are surrounding them in India? And in the recent discussions, there have been employment opportunities, which we have briefly touched upon in our discussion as well, right? But in the future or in the coming future, what are the sort of employment opportunities or changes that we can expect to support them or to actually make a change?
Right. One is to becoming more and more sensitive about these identities itself. We look at prostitution or sex work, commercial sex work, or begging as something um, extreme, as something bad, right? So, can we change our own perspective about commercial sex work and begging? Can they be legitimate professions by themselves, right? A seer of a mutt goes and asks for donation. That is not looked down upon. Political parties go to people and ask for money to fund their party activities. That is not considered bad at all. People keep raising donations for a lot of things, but a trans person begging becomes a big problem. Similarly, with sex work, can these be considered legitimate? First, if you can legitimize these professions, legitimize these occupations, is how I look at it. Then, of course, like we've already discussed about, how to increase representation, how to bring about anti-discrimination in health and in the education sector, that allowing people with different gender identities and sexual orientations to access more and more opportunities. That way we can create slots. They can be represented across, instead of limiting. For example, a trans woman will always be a secretary or a receptionist. Again, these are all tokenistic representation. They can be there as any like currently you cannot serve in the Indian military services if you're from the LGBT community. This is the anti-discrimination I'm talking about. So if we can change this, perhaps there will be representation across all walks of life. So we don't have to, we no longer have to see people only, like the rural or urban trans sex workers or trans beggars on the street. You can see them as doctors. How willing are we to go to a trans doctor? How willing are we to go to a gay establishment? So these changes can happen once we become more and more anti-discriminatory.
So before we move on, we'll just try to quickly see if there are any questions from the audience.
hmm.
Uh, so one of our viewers had a question regarding how to cope with body image issues faced by gay men.
So this is a very specific question. I will need to understand the context in which this person is experiencing these issues. And of course, body image issues can be very, very specific to queer people, and queer people may experience, especially trans women may experience significant body image issues with if they are not on hormones and the hair fall and all that. Similarly, with a gay person, I will need some more details about what is happening with this person to be able to respond to a specific question like this. We have other psychologists in the room. If you have any thoughts, please go ahead and share.
So I will just share a little experience I had during my like studentship. So many people used to come to government hospitals from the rural sectors, and as because back then there was not much awareness about this queerness or transgender, identity, how they can be different or rather inclusive as well, they used to come with a complaint of, give me certain pills so that, my beard goes away or I become fair. So some people come with, need for medication or certain counseling so that, my voice becomes like a sort of girl, or I am accepted in the society to wear mehendi. So all these things, I guess, how they want to represent themselves in terms of their appearance has also been a struggle. Because till now, like, although we talk about allyship, we although talk about a lot of evolution in terms of representation, we still, we talk about people who walk in a certain way or talk in a certain way. Generally, many teenagers who go through this pubertal changes, whose voice starts changing around 14, 15, they get discriminated or bullied in terms of, you're talking like a girl, or you're being so manly, like girls who are into sports, even if they are cis. So I think appearance is a very intrinsic thing to us as humans. So dealing with body image issues, if we are able to see it in terms of the person's identity as a human, how I want to represent myself, I want to look in front of the mirror, it will be better to approach than to see it specific to, gay or a trans or something like that, as per my opinion.
Right.
I
I
also
understand
see,
that. Yeah, please
yeah,
go ahead.
I also see that even with this kind of a body image and other things is also coming from the background. They are like somewhere this intersection of an urban rural also do play a role. So for example, in an urban setting, just because of some kind of an exposure, there's some level of an acceptance I could see when they behave in certain ways, when they identify themselves the way they like it. But in the rural background, I see there's still a lot of discrimination and a judgmental perspective coming across. And I do think that do also play a role somewhere to build up a body image of in certain ways. Yeah.
Right. I beg to differ with you, Ankita. And, if body image disturbances for everybody is same, there are certain unique challenges that queer people experience. So, as a gay man, I again, did the person say self-image or body image? Body image, right? So
Body.
again, what part of the body image is distressing for this individual, and what are the thoughts around it? We don't know much about exactly what they're saying, but again, uh, our normative experience of men, cis men, is a certain way. You're supposed to be tall, you're supposed to be burly, you're supposed to be hairy, you're supposed to have a certain voice, a deeper voice. All of this is all part of the body image that we have internalized, of of that of a man. If this is the person talking about, as a gay man, I do not fit the stereotypical man's image, and that is causing the distress, right? I'm assuming this is where the person is coming from. So it requires a lot of work for me to accept that there is no one idea of a man, there is no one idea of what a man should look like, and all, what I experience is a normal experience. So me coming to accept that there are diversities, no two men, no two cis men are alike, right? And there is no one definition, because the society keeps telling us that a man is like this, a woman is like this, a girl is like this, a boy is like that. But in reality, no two people are same. So recognizing this diversity and accepting them as normal variations perhaps may ease with this distress this individual is experiencing about their own body image. So again, it may be helpful for you to reach out to a mental health professional to discuss in detail about what is happening with you with respect to your body image. And body image disturbances can be part of some other pathology also sometimes. So it may be helpful for you to reach out to a counselor, a psychologist, or a psychiatrist.
You're absolutely right, Dr. Mohan. Are there any other questions, Shanvi?
No, I think that was the primary question.
Right. So before we we've almost reached the end of this discussion, before we sum up, can you just share a little bit of your experiences of your work that you have been doing since years with this community?
Right. I'm not an ally. I'm a member of the community.
Okay.
I identify as a bisexual man myself. I have been part of a support group in Bangalore for 12, 13 years now. So I'm quite connected with the community as a member of the community. And as a mental health professional, as a psychologist, I've been working predominantly with people who are seeking gender transitional services. I worked with a medical college in Bangalore till about 2 months ago. I moved to Australia recently. Uh, there, I predominantly work with people who were seeking gender transition services. In India, it is required, or across the globe, it is required that people who are seeking gender transition services need a letter of recommendation from a psychiatrist or a psychologist to say that they are experiencing gender incongruence or gender dysphoria for a certain period of time, and they may benefit from gender transitioning services. So we've had different laws governing that. We don't have India specific guidelines as such, as not as endorsed by any professional organization. We do have IPAT, Indian Professional Association of Transgender Health today, but again, I'm not sure how much it is endorsed by professional bodies like IMA or the Psychologist Association. We don't have that. We have different states, like for example, West Bengal has SAFO guidelines. Tamil Nadu has Pondicherry has their own guidelines. Different states have specific guidelines. We don't have them. So my journey was, traversing these difficulties in not having a legal framework to provide the support. We did develop guidelines for our institution, not for our state, which we followed, which is again based on the World Professional Association of Transgender Health, WPATH, which is the seminal body in transgender health. We based our guidelines on that, and we were working predominantly with people who are seeking. The biggest chunk of patients who came to our hospital were mostly trans women from marginalized sections, like the sex workers and the beggars that you talked about. These are the people who mostly came to us, but we did have sizable number of trans men. Trans men mostly came from middle class urban backgrounds, so assisting them, helping them explore their gender, and helping them see what kind of transition services might be beneficial for them. Should they go for cosmetic, hormonal, or surgical transitioning? Assisting with that has been predominantly my work. I'm not sure whether I'll have the same similar opportunities in a different country now, but yeah, I continue to work in this area. I did take part in some studies also. We have an ongoing study, again in collaboration with Tata Institute of Social Sciences, where we are looking at the experience of mental health professionals who have been working with gender diverse clients, and what theories they use, what difficulties they experience, their own personal challenges, professional challenges that they have experienced. We've been trying to explore that. So that has been my experience with the transgender community predominantly.
Thank you so much. This has been an added value to our discussion. So it has been really a wonderful journey in this, and it's very insightful in this panel discussion, this Q&A discussion today. And I guess your insights have provided an extraordinary value to our plethora of knowledge and to all the audience as well. We're actually elated and immensely grateful and thankful for you to have
My
give time
pleasure.
for us and your contribution. Thank you so much.
Thank you so much for inviting.
Yeah, thank you so much,
Right.
Mohan.
Right. Bye bye.
Bye. Thank you.
Thank you.
With this, we end this session. Have a good day.
Thank you. You too. Bye bye.
Bye.